Hello friends, today I'm sharing a very important video regarding management of COVID-19 pneumonia. A lot of people, a lot of my friends have been asking me, is there any specific guidelines for management of COVID-19? Yes, the AIMS has issued a guideline, which is like a flow chart, like a protocol. But there are certain things that I want to share so that it increases your medical vocabulary and there's a better understanding about management of COVID-19, which is a big crisis going on currently. So first thing I want you to know is please do not panic, because around 80 to 85% of cases are asymptomatic, and they usually will not have a lot of symptoms like the breathlessness or the cough or even fever for that matter. And remaining 15% patients may come up with a very minor symptoms. 10 to 12% patients may come with very minor symptoms like fever or sore throat or cough, and it's usually those 3 to 5% patients who are actually requiring an ICU care and have a complicated pneumonia. So first thing is, don't panic, because currently what I'm seeing is a lot of pharmaceutical companies, a lot of hospitals are trying to trap people by making use of the situation, and a lot of people are putting in a lot of money for treatment of COVID-19 even when they are quite asymptomatic and they just need a home quarantine. This panic situation is being misused by the private medical sector. So be very careful about it. What are the symptoms that you should be careful of? Is shortness of breath. If you are having breathlessness, if you are having shortness of breath, your fever isn't subsiding by 1 or 2 days, then it looks like you need to be in hospital, and you need close monitoring of your disease progression. One another thing I want you to know is Spo2 monitoring, which is very important, and a new test which has come up, which is quite simple to do and quite efficacious. It's quite efficacious. It's called the 6-minute walk test. So you ask the patient to walk around for around 6 minutes, and then you look for any drop in saturation if the patient has. So if you see a significant drop in saturation or saturation falling down below 90, then that's an indication that there may be changes starting in his lung and he may be susceptible to having hypoxia. So that is a very easy test to perform, and for those who are at home, they want to know about the disease progression, I would recommend that if they can do it at home, a 6-minute walk test and Spo2 monitoring, that's a very good method of predicting how disease is going on in your body. Second important thing I want you to know is hydroxychloroquine prophylaxis. A lot of people, a lot of international data has come which has said that hydroxychloroquine is not a very effective prophylaxis or effective treatment, but I would recommend you that's not true. From my personal experience, HCQs basically try to understand hydroxychloroquine is not preventing you from getting COVID. It is only preventing you from getting complication of COVID, because what actually is happening is what we are seeing is patients have a pattern of ARDS, which is not exactly due to a lot of inflammation in the lung. Rather, there is some process by which the affinity of oxygen to hemoglobin is decreased. Now, how exactly that is happening is still a big research field, but what we have seen is definitely the virus is decreasing the affinity of oxygen and hemoglobin. So if you have hydroxychloroquine that is increasing the affinity, there's somehow the oxygen and hemoglobin association is being maintained by hydroxychloroquine, so you are less susceptible to getting severe disease or severe hypoxia. It is not preventing you from getting COVID-19, it is only preventing you from getting a severe hypoxia or a severe complication of COVID-19 pneumonia. So get it right. So hydroxychloroquine prophylaxis I definitely recommend, especially to all healthcare workers. I myself am on regular hydroxychloroquine prophylaxis, and I would recommend you also to continue. And the dose is quite simple. You have to take around 400 milligram stat, and then repeat after 12 hours, and then you have to continue 400 milligram every weekly. Normally it's indicated for around 7 weeks, but if you are in the profession and you are in constant exposure with COVID-19, I would recommend you to continue that, because If there's no side effects except for GI side effects, I personally haven't received a lot of patients complaining of a lot of side effects, especially with just 400 milligram once a week dose. So I would recommend you for hydroxychloroquine prophylaxis. It's not bad, and in India we have had good results with hydroxychloroquine. Even the ICMR has had good results with hydroxychloroquine prophylaxis. Next important thing is the antibiotics. We do give antibiotics because we want to prevent secondary bacterial infection. The viral pneumonia itself is a fertile ground for other bacterial infections to grow in. So you do give antibiotics. So preferred ones are usually the azithromycin and augmentin. A lot of people have a very good result with azithromycin, but in my experience, even augmentin does a lot well, especially when the patient is already on HCQ prophylaxis or you have started him on hydroxychloroquine. Giving azithromycin simultaneously has a good risk of developing QT prolongation and arrhythmias. So I would recommend you, if the patient is already on HCQ prophylaxis or you have started him on HCQ, augmentin is a better choice as compared to azithromycin. That's my personal view. Although a lot of people have simultaneously given hydroxychloroquine, azithromycin, and they did have a good result with a lower complication rate, but still safe to get augmentin. It's broad spectrum and it doesn't interact with hydroxychloroquine. Next important thing I want you to know is in the management is as I previously mentioned, that the kind of hypoxia that you are getting is again a very strange kind of hypoxia, which is sometimes also referred to as a happy asphyxia, because you see the saturation is quite low, like 88 or 86, and the patient is not very symptomatic about it. He may be in fact developing breathlessness by the time his saturation has fallen down to like 80% or 82%. So that's why it's called as happy asphyxia, because there's hypoxia but the patient is not very symptomatic about it. Now this exactly is the reason why certain people are postulating that it's not actually a complete AIDS kind of a response, but it's rather like a high altitude pulmonary edema. When you have a hypoxia, the body, the capillaries in the lung, they basically react by dilation, and then there's a development of a reactionary pulmonary edema secondary to the hypoxia. This kind of mechanism is what is being postulated as the reason for development of AIDS and pulmonary edema in the COVID-19 patients. So for the same reason, even giving a very high PEEP via ventilator is not shown to have improvement in hypoxia. Prone ventilation is doing a lot better. Oxygen supply, simple O2 and prone ventilation, even with the oxygen, has definitely proven a better way of maintaining your saturation. So this is again the reason why hydroxychloroquine is, like I mentioned previously, is doing good, because it is kind of creating an increased association of the oxygen and hemoglobin, and the chances of you developing hypoxia is less if you are already on a hydroxychloroquine prophylaxis. Second important thing is the inflammatory response. We know that the virus itself is definitely dangerous, but then a lot of patients are having complications because of a cytokine response or an increased inflammatory response. So they are having a massive whiteout kind of a lung, which is again due to inflammatory response. Then they are showing severe signs of sepsis, and even patients have gone into septic shock. So this kind of cytokine storm or inflammatory response is being seen, and that is very well being managed by dexamethasone or steroids, and it's no harm in giving steroids, especially when you are already giving antibiotics. With the cover of antibiotics, dexamethasone is definitely a drug of choice for these kinds of patients, and it has definitely reduced the mortality and morbidity. Another important thing I want you to know is antiviral agents. A lot of companies are coming up with antiviral agents. Let me tell you that none of these agents have been tried and tested in a proper clinical trial. Because of the shortage of time, every company has been misusing this situation, and they have been already recruiting a very healthy group of patients for testing their antiviral agents, and as expected with healthy patients, they all have been coming up with a very positive result. But when the patient's condition is very poor, like if he's having an inflammatory response, or if he's having significant hypoxia or a cytokine storm, then these agents have not been proven very effective. So in In mild to moderate cases, even without antiviral, patients have a good outcome. So whether these antiviral agents are really efficacious is a big question, and they are more likely to be money trapping agents by the pharmaceutical company. That's what I feel, because the two agents that have come, like the remdesivir and the favipiravir, both of them advocate that it's not recommended for severe kind of a disease. So for a mild to moderate kind of disease, I would tell you that it resolves on its own. So whether these antiviral agents are actually efficacious is a big question mark. So I do not recommend you to go for these antiviral agents if even if it is a mild disease. It's of no use, because they are very expensive and they hardly are putting any change in the prognosis. And if it's a severe disease, they anyways recommend that it's not being very effective. So be very careful of these antiviral agents. They are more looking like they are more for the business of the pharmaceutical companies than for the benefit of the patient. Another important thing is nutrition. Definitely nutrition is a big plus for all kinds of infection, whether it be any infection for that matter. So people have told me whether we should be taking vitamin C prophylaxis or zinc. You can very well do that. There's no contraindication for that. Only thing remember is when you are taking vitamin C, keep a well hydrated body, because vitamin C gets metabolized into the oxalate, and that is secreted via the kidneys. So you have a good chance of getting oxalate stones. So have adequate hydration, drink a lot of water. Vitamin C, zinc containing multivitamin tablets are definitely a plus for all kinds of diseases for that matter. They just keep your immunity on your toes, so that you can fight well any disease for that matter. Why only COVID-19? And a high protein diet is definitely recommended. So these are the important things that I wanted to share from my experience. Some people have also asked whether there's an indication for low molecular weight heparin. So listen, if there's a high D dimer, then you can give a prophylaxis of low molecular weight heparin, because during recovery small and medium vessel diseases has been seen. Even patients are presenting with stroke and myocardial infarction. So that's again definitely, if the D dimer is high, you can give a prophylaxis of LMWH, although aspirin has no significant role currently. So this is important points that I wanted you to know regarding management of COVID-19. And I hope this tough time will be countered by all of us very effectively if we have the knowledge about it. We should not run panic into situation, because people are misusing this panic situation to earn money. So don't run into any panic situation. Follow those important things that I have already mentioned, like Spo2 monitoring being a very important screening, the 6-minute walk test, very important screening method. HCQ prophylaxis, it reduces the chances of developing hypoxia. For complicated disease, even antibiotics should be started, appropriate antibiotics should be started. In that, augmentin is more preferable as compared to azithromycin. And the kind of hypoxia that we are getting is more of a high altitude pulmonary edema, so giving a lot of PEEP by the ventilator is not doing a lot well. In fact, prone ventilation is doing a lot well. And if there's an inflammatory response, the patient is showing signs of severe cytokine reaction, then dexamethasone is definitely indicated. Antivirals, the new antiviral agents, a big question mark. Their efficacy is definitely under scanner. And supportive therapy in form of low molecular weight heparin can be tried if a patient has a high D dimer. And nutritional support is definitely a big plus for all kinds of diseases, including COVID-19. So a high protein diet, diet rich in vitamin C, diet rich in zinc, and an adequate hydration will definitely help you to counter the disease much better as a normal patient does. So that's all. I hope it was informative for you. You did find some important key points in management of COVID-19. Thank you.